When I do presentations, I share a picture of the day that the eBadge Academy, you could say, was created. It was in 1996, and it's a picture of President Clinton in the Oval Office receiving a report from a woman with Down syndrome.
Sometimes what we hear is particular DSPs are good with the guys. And what we're trying to help DSPs see and organizations see is that that's not magic, that's skills. As they start to understand how skilled they are, they start to approach their work with a confidence, and it has a big impact on the work that they do.
And we're trying to create a professional, intentional workforce.
Welcome to IDD Leader, where human services leaders grow their impact, lead with heart, and build the workplaces our field deserves. I'm your host, Nate Beers. Let's dive in. What if I told you that somebody else has done all the heavy lifting for you to have a more stable and a more skilled workforce? Would you believe me? Well, hopefully after today's conversation, you will. My guests today, I'm very honored to have them, are Joe Macbeth, the president and CEO of the National Alliance for Direct Support Professionals, and his colleague, Dan Hermrick, who oversees their eBadge Academy and this credentialing process for direct support professionals. These guys have been going at it for a long time in making a way for this profession, direct support professionals, to get more fully recognized, but also more fully skilled, or standardization of the skills that they have. And you're going to hear all about how it works. And if your organization is not already involved with this, you may really, really want to consider it after hearing just the outstanding results that they're seeing. And really, you'll get a picture not just of how it can help you with your organization, absolutely, but also the bigger picture of what's happening across the nation when it comes to the professionalization of people working as DSPs. So without further ado, this is part one. I should say that. This is part one of two. Without further ado, enjoy today's conversation. In your conversations with DSPs across the country, what's the most surprising or unexpected story that you've heard? And what does that reveal about the workforce challenges that providers are facing today?
You want me to take this one first, Dan?
I think this has Joe written all over it.
Well, it's interesting. It's very nice to be here with you today, Nate, first of all. And I'm honored to be with my colleague, Dan. We have a lot of questions on the eBadge Academy. I'm sure we're going to speak a lot about the eBadge Academy, but prior to launching the eBadge Academy, we went around the country and spoke with a lot of direct support professionals in not necessarily focus groups, but information forums, just to get them to share their stories and tell us about the work that they do. What we wanted to do is we wanted them to connect how they help people, leading to some sort of outcome, and connecting their work to competency areas or skill standards, which is really a foundation of the eBadge Academy certification program that Dan will talk about later. But we wanted DSPs to be more intentional about their work, that, helping people achieve things, big things and little things, are almost always connected to a skill standard. And skill standards are validated by research. So there's research behind the work that direct support professionals do, and they often don't give themselves credit for it. And going around the country and doing these types of forums with direct support professionals and getting them to share about their work, and reflecting on, yeah, I helped somebody do this. Some of the stories that we heard were just incredible. We had a DSP share a story how, her staff would help the people that she supported in this group home to go on vacation every year. And the five guys who lived in this group home would go to Florida every winter, which is when you live in upstate New York. That's where you go in the wintertime, right? And during the planning process, she noticed that one of the guys just wasn't really interested in participating, and and that's what we would call informal assessment, right, Dan? That's an informal assessment that a DSP kinda noticed something wasn't
Yeah.
just quite right with this one guy. And in order to allow him to have, save his dignity or whatever, she waited until later and asked him about it. She said, "Hey, I just noticed that you weren't really participating in this conversation. I always thought that you loved going on these vacations with us." And he said, "I do, but I want to do something else." And and when a direct support professional hears something like that, it's not Make-A-Wish Foundation, right? It's you have to take this information in, process it in real time, and give good feedback and we don't really often say, "No, you can't do this." She goes, "Well, where would you prefer to go?" And she gave us a little background about this gentleman who was a very, proud and practicing Catholic, and he wanted to go to Europe and meet the Pope. Now now, sometimes as a direct you hear a lot of stuff as a direct support professional, but she didn't discount that. And part of our code of ethics is about respecting a person's desires and wishes and help them pursue those. So she didn't say no. She said, "Let's work on it together." And over the course of a year, the two of them worked with the team, worked with his family, found out finances and would Medicaid, be available in case something happened while he was overseas, and do you even have an opportunity to meet the Pope? She didn't know. Well, they made it work. They made it work. The
Hmm.
direct support professional, through a whole series of obstacles and barriers and people saying that you just can't do this, they went to the Vatican. He met the Pope. He has a picture of the Pope in his bedroom, and that's a DSP who paid attention.
Wow.
Now, that's a huge story, right? That story in and of itself is, well, it is kinda like Make-A-Wish Foundation, but you know what? It's a DSP who was paying attention, who didn't say no, who worked in with another one of our skills or competency areas is organizational participation. So had to go through all of the um, rules and regulations and policies within the organization. She navigated all of this stuff. My point is, DSPs have stories that need to be told, need to be shared, and our job is to connect what that DSP did and help her connect that she probably worked on at least 4 or 5 different competency areas in that one effort to help somebody go on a vacation that he really wanted to do. Can't get any better than that.
No, absolutely. Wow, what a great story to kick things off here. Now I put the cart ahead of the horse here a little bit. Can you guys each introduce yourselves and share your role at NADSP? Probably define the acronym as well, and maybe in a nutshell, to kind of define the work that your organization does.
You want me to go first, Dan?
You can go first.
My name's Joe Macbeth, and I'm the president and CEO at the National Alliance for Direct Support Professionals, the NADSP. We are the only national organization whose sole purpose is to elevate the status of our nation's direct support professionals, and we do that in a variety of ways. We do a lot of advocacy and public policy work. We have some training curricula. We share a whole lot of information. We try to engage DSPs in their profession. We're trying to raise the bar about their work. And we have a very interesting and compelling certification program called the eBadge Academy, which has taken off over the last 4 or 5 years. That is the brainchild of my colleague, Dan Hermrick.
So I'm Dan Hermrick. I'm the Chief Innovation Officer for NADSP. And for a long time, my role was Director of Certification, and I was overseeing the day-to-day operations of the eBadge Academy. More recently, I've been moved into a different role where I'm more focused on expanding the eBadge Academy and improving the eBadge Academy. But yeah, it's something that has been what, 7 years in the making now.
Wow, that's great. Well, we're definitely gonna dive into the eBadge Academy in a few minutes. But first, maybe just give a little bit more of the backstory. What led to the creation of the NADSP in the first place, and what gap in the field were you trying to fill?
Well, the eBadge Academy predated both Dan and I. There's a when I do presentations, I share a picture of when the eBadge Academy, the day that the eBadge Academy, you could say, was created. It was in 1996, and it's a picture of President Clinton in the Oval Office receiving a report from a woman with Down syndrome, and there were 4 other people in the room with the president and this woman. Her name was Ann Forts, the first person with an intellectual disability to receive a presidential appointment. She was appointed to the President's Committee for People with Intellectual Disabilities, the first ever. Um, and now today, actually, that committee, the majority of the composition of that committee is made up of people with disabilities, which is a really good progress. But the other people in the room were members of the committee, and one of the prominent people on that committee was John F. Kennedy Jr. He was actually the chair of President Clinton's PCPID. And that the committee is charged with delivering a report to the president each term. The report can be on anything. The report could be on anything that is important to people with disabilities in the United States. So in 1996, the report was the first report to government that identified the direct support workforce crisis in 1996. And in that report, it talks about a lot of potential solutions for this workforce crisis, which is 30 years ago. By the way, a crisis doesn't last 30 years. A crisis is sudden and unexpected and temporary, which is why we don't use the term crisis. Not to say that provider organizations aren't in crisis, they are, but it's to me and NADSP, it's a more of a systemic failure than a crisis because it's been lasting for decades. Anyways, in that paper, one of the recommendations was to create a national alliance of care workers in the IDD sector. And it got a lot of attention. When John F. Kennedy Jr. was involved with this, of course, he was leading the charge and trying to get other stakeholders in the IDD sector to be part of this movement to create a national organization. And he was highly successful. And then, of course, he died in 1999, and the momentum kind of stopped. And thanks to the good folks at the University of Minnesota's Institute on Community Integration, we were kind of housed there for about 10 or 12 years, where under the leadership of Dr. Amy Hewitt and Dr. Charlie Lakin, who were true believers in the workforce and did a lot of the research around the direct support profession, we created our first iteration of the Code of Ethics. We created and adopted the community support skill standards, the first version of our national certification program, which was Dan will talk about it later, a portfolio-based, a very academic, very intimidating portfolio credentialing program that was really wonderful, but it was never built to scale for a variety of reasons. And then we started to collect some funds because we were starting to get membership. And once the University of Minnesota was sitting on X amount of dollars, less than $50,000, there was a board of directors at NADSP at the time, and I was one of them. They invited us to get out of the comfort of the university system and go out on your own as an organization. And I remember trying to find somebody to run the organization because it was basically run at the university, and they had a lot of very competent and highly skilled staff to do it. And they did a national search for a part-time executive director, and nobody applied for it. This was back in 2010, and somebody asked if I would be interested in doing it, and I said, "Why not?" You know, there's a lot more to it, but so we had $50,000 and we had some great ideas, the code of ethics, the competency areas, something around a credentialing program, but we didn't have a strategic plan. We didn't have a budget. We didn't have a business plan. We had $50,000 and a lot of goodwill, and we made it work. Today we have what, 13 full-time employees, Dan, and probably 15 part-time employees and a lot of contractors, to help us spread our work. So we got lucky. We partnered with the right people. We had a lot of people who supported us that we owe and are indebted to for a long, long time. And I think the NADSP's mission is something that basically everybody in our field can get behind. And when you have a mission that resonates with people, people understand who direct support professionals are and the value that they have and bring to people with disabilities in their lives and their families, you get a lot of good people to support you. So that was the key, in my opinion, on why NADSP was successful, is that we had a mission that we never strayed from, ever.
Hmm. Yeah, and it sounds like, and I completely agree with you. It's the kind of thing where it easily resonates, and then easy to get behind.
Yeah, yeah,
Um, because the success of basically services rises or falls on that front line.
absolutely right.
For leaders that aren't familiar, and there probably are many that are, but how does the NADSP credentialing and the eBadge Academy work?
Well, the thing I always like to start with is that we are not a pre-service certification. There's many other professions out there where the model is, you study really hard, you go to school, you take a certification exam, and then you're able to work in the field. And we have a very different approach. We're an incumbent worker certification. We're designed for people who are already working in a direct support role. So, with that in mind, we have 3 levels of certification. And we're not that creative, so we call them DSP1, DSP2, and DSP3. And the way that you earn them through the eBadge Academy is through stackable electronic badges. We know DSPs are busy people. We know they have a lot on their plate. We know they're working 2 or 3 jobs in many cases. We know that setting aside time to work on a certification is challenging. So these individual badges, each are designed to be about 15 minutes of work to apply for. And if you get enough of them and get the right ones, then they stack and become a national certification. So the idea is really you kind of chip away at the certification requirements, one badge at a time, when circumstances allow. One way you can earn badges is by uploading your training records. We do require 50 hours of NADSP accredited education for our first level of certification, and we require an additional 50 hours of NADSP accredited education for our second certification level. There's a lot of programs out there that NADSP has accredited, and different providers have chosen to contract with different training providers. So if you're a Relias organization, there's a whole lot of Relias modules that count toward our certification requirements. If you're a College of Direct Support organization, we've got a whole lot of, the entire direct course library counts towards our certification. If you use Open Future Learning, those modules all count towards our certification. There's some others that are more regionally based, state level curricula that are out there at particular schools or offered by particular organizations. Um, there's options. There's different avenues to getting those hours of training that you need. That's one way to earn the badges, just by uploading those training records. The other way is what we call core competency badges. And those are earned by describing how you're using your professional skills in real situations on the job. Joe mentioned there are these nationally validated competency sets for direct support professionals out there. And one of them is from CMS. There's the CMS core competencies that the actual branch of the federal government that pays for most of the human services in this country has published to say these are the skills that are necessary for people to be successful in a frontline human services role. They're broken down into 12 competency areas. And then within those competency areas, there's individual skill statements that are more specific. We turn those skill statements into badges. So, for example, we have a crisis intervention badge. Direct support professionals need to be able to support people when they're in crisis. And so we have a particular badge where DSPs upload what we call a testimonial, where they describe how they've done that, how that skill has come into play in their day-to-day work, how they've demonstrated that particular um, skill. And then we have, household management. How have you helped people to have more control over their household management? You've maybe helped them to do the laundry more independently. Um, we have meal prep. How have you helped people to have more control over meal preparation? Maybe that involves making a shopping list. Maybe that involves going to the grocery store. Maybe that involves chopping vegetables. What skills have you used in the area of meal prep to help people gain more independence in that aspect of their lives? And we have dozens of these, all these different ways that direct support professionals support people in their daily lives. And you again, take about 15 minutes, put together this testimonial where you describe what you've done and how you've demonstrated the skill. Upload that to us. Whether you're uploading training records or uploading testimonials, these go to reviewers. We have a sort of army of reviewers, and these are all people who work in human services. They're all people who've, set aside some time to review the testimonials and the training records that have come in from across the country. We feel like it's really important for people who are doing these evaluations to be people who are actually doing similar work themselves. And we have rubrics that we give them. If everything checks out, if the testimonial hits all the points that it needs to hit to demonstrate that skill, um, or the training records are correct and valid and add up to the correct number of hours, then that reviewer gets to click approve, and then that DSP earns a badge. If there's something missing, the reviewer has to write a denial note explaining what's missing from this testimonial or from this training record. So sometimes on the training side, people might upload non-accredited training into their Relias platform, let's say, and there'll be a mix on the transcript. Some stuff we can count, some stuff we can't count. We'll explain that in the denial note. You think you have 50 hours, you actually only have 48, 2 more hours, and you'll be ready for this badge. On the testimonial side, sometimes DSPs misinterpret the skill statement. They give us an example that doesn't really fit. We have prompts to help guide the process of writing the testimonial. And the first prompt is always trying to draw out the narrative from them about what happened. DSPs are pretty good at that. They've done a lot of documentation in their lives. They can tell you, a sequence of events and how it all unfolded. The second prompt is a lot more reflective. And that second prompt can sometimes be a struggle, especially when people are new to the process. It's the kind of stuff that you wouldn't necessarily put into a case note or an incident report. How did this line up with the ethical standards for your profession? How did, how did this fit in with the concept of informed choice? And so sometimes we have to deny things because they did a great job on the first prompt and they really have an excellent example, but we just need to draw more reflection out of them before we can approve it. And again, 15 minutes here, 15 minutes there, you're chipping away at the requirements one by one and ultimately earning a national certification.
The other thing I wanna just add, Dan, you know, part of the issue with our portfolio certification was it took a DSP probably 12 to 18 months to complete a portfolio, examples of their work. And it would take us 3 months to review it. And maybe they would achieve the certification, maybe they wouldn't. The beauty of the eBadge Academy is when one of our reviewers receives the testimonials from a DSP, they have 3 business days to review it and either approve it or deny it with a note. So people aren't waiting around. Sometimes it's almost immediate, where you get that feedback from one of our reviewers. The other thing is all of our reviewers have passed an inter-rater reliability exam. So we know that they are competent reviewers and they know what the skill standards are. And the last thing I would like to say is we really are interested, I'm very interested in getting people with lived experience, lived disability experience in reviewing badges as well. Because who knows ethical or skilled supports better than somebody who receives them? So we have a cadre of some really great eBadge reviewers. It is kind of like the United States mail, where it just keeps on coming and coming and coming and never ends. And our reviewers do a great job.
So this is cool. I'm hearing kind of a couple different things. First of all, I love that people are now hearing back quickly. Um, Dan, I relate because my background is a behavior analyst. And so, yes, lots of hours in the field, but then you do sit for a very stressful, long multiple choice test at a testing center. And so I hear how this is different than that. But what I was about to say is, to your point, Joe, getting that feedback quickly would allow people to make course corrections or adjustments, or even not fill it out, incorrectly 15 times before they found out, oh, you were actually asking more along these lines. And so I can see how that'd be really valuable. And then, I mean, I don't know if you guys give them like a progress bar, but in my own head, I started like picturing like a progress bar of like, you can see as you're getting closer. And
It's
that would
not a
be,
progress bar, but it's a nice electronic checklist.
yeah, it'd be very encouraging. It'd be super encouraging as you're seeing that for those going through the process, they would know exactly where their progress is in that process. So that's really cool. What kinds of changes do you see in DSPs once they complete a credential? Maybe something about how they maybe show up different to work, or
Yeah,
anything.
that's very much what we hear from organizational leaders. Had an organizational leader in New Hampshire tell me she doesn't need to go into the system to see who's certified because she can tell just by watching their approach to their work. And we've heard similar things from across the country. I think ultimately the difference is that, in theory, the eBadge Academy is all about DSPs convincing us they're skilled professionals, but along the way, they're convincing themselves. There's all these things they're doing day in and day out, but they probably don't ever say to themselves, oh, this was me using my professional skills in advocacy. This was me using my professional skills in crisis intervention and person-centered supports. But when they start to make those connections that, this isn't, sometimes what we hear is particular DSPs are good with the guys,
Yeah.
right? People will say that, like, there's just something about that DSP. They're good with the guys. Things just seem to go more smoothly when they're around. And what we're trying to help DSPs see and organizations see is that that's not magic. That's skill. That's skills that DSP is bringing to the table. And so, yeah, as they start to understand how skilled they are, they start to approach their work with a confidence, and it has a big impact on the work that they do.
Yeah, I like that. It would really help that break down the specific skills. And it is easy, I think, on the outside looking in for someone to just sort of, I mean, you can kind of readily tell, like, oh yeah, things go smoothly when that person's in the group home, or things go well in that person's group at a state program or whatever. But then to say, well, it's not just because they're who they are, it's the actions, it's the things that they're doing. And so that's cool that so it would actually give, I guess, if I'm kind of thinking this through, it would give language even to direct support professionals about what they're doing.
If yeah, and one of the things that we talk about often is that professionals, all professionals, go about their work with intention, and intention is informed by training or education or something like that. But knowing DSPs who have once I believe, Dan, correct me if I'm wrong, the first level of certification is usually the most challenging
Yes,
for a DSP to achieve. But
absolutely.
once they have the process figured out and start drawing the connections between the work they do with the skill standards, you have an intentional professional. Now, direct support professionals, prior to this, I mean, they're relying on their intuition. I know this guy and I know what he likes, and this is how I'm going to work with this guy. And that's fine because DSPs need to be intuitive as well, you know? So you have to balance intuition and intention. And we're trying to create a professional, intentional workforce.
Wow, amazing to hear the work they're doing and how they're just setting you up and me up for success with the way that they've created the credentialing process. It was actually hard to push the pause button, but I promise you, part 2 of this conversation, the second half, will be released with the very next episode. Now, I always try to leave you with one action item. Before I share it, I want to ask you this question. In 2010, did anybody encourage you to buy Bitcoin? Do you realize that if you'd spent $20 to buy Bitcoin in 2010, you actually would have gotten 400 Bitcoin? That same investment, had you bought and held it this whole time, would be worth more than $46 million as of the time of this recording. Whoa, talk about a crazy ROI. Well, on the one hand, it might not be quite as extreme financially, although it is an exceptionally good ROI financially. But it's also priceless when it comes to quality of care, quality of people's lives increasing. But what the NADSP is doing with their eBadge Academy, with credentialing DSPs, and just helping to professionalize this skilled profession is so invaluable. But it's not just something that's out there. It's something that you can apply and have at your organization. So if you do not have a credentialing and career ladder path while staying a DSP, not just promoting to become a supervisor, although that's wonderful too. But if you don't have that, that's my action move for you. I strongly encourage you, go on their website, nadsp.org, look up their eBadge Academy, and start your first cohort as soon as possible. I do not think that there's any way that you could be disappointed with the results that will happen from that. And seriously, this is your 2010 Bitcoin moment. Use it wisely. Also, if you want to stay up to date on everything that's going on with IDD Leader, or you just want to get a really cool, simple PDF download that describes 4 supervisor habits that you can just like hand this to your frontline supervisors, but that actually help to retain staff, go check it out at iddleader.com/supervisor. I think you'll really enjoy it. And seriously, somebody needs to hear this episode. Share this with a friend, with a colleague, or you can pay it forward by rating and reviewing it on Apple Podcasts or leaving a comment down below on YouTube. Whatever you want to do, but pay it forward because this message needs to get out there. And they've made it so easy for your workforce, again, to get more stable and more skilled, which is just a win upon a win upon a win. So until next time, here's to you. Keep up the amazing work.